Hello, Facebook. Dr. E here with another COVID update. Today is Wednesday, March 25th, and we've seen the numbers continue to rise as expected. Like I said yesterday, let's try to not stress about this. Over the next couple of days, we will undoubtedly continue seeing the numbers increase, and that is expected, and that is something that we all knew was going to happen. So don't get discouraged if you listen to the news and they keep saying that the numbers keep rising despite all the measures. Every single measure that we've started taking in the last week or so will not be reflected until about 2 weeks from today. All right, or from then. So at least another week and a half before we really start seeing if we are being able to flatten that curve. Now, I want to remind you, what does this flattening the curve means? It means that there's not a lot we can do to prevent a lot of people from getting the virus or from being exposed to the virus at some point. Now, this does not mean that we should not care and just go out and say, well, it's not going to hurt me, it's not going to kill me, because despite it might not, we don't want everyone to get it at the same time. Right? I had a very enlightening conversation yesterday with Dr. Laura Beatty, and she is a primary care provider. She's a family physician, and she's also been working at the ER of her hospital in Atlanta, where she's at. And one of the things that she shared with me, which we already knew, is that the system is currently almost at capacity. The healthcare system is almost at capacity, which means that we're running out of beds. Now, that's not the worst part of it, which is already pretty bad, because we've been seeing in the news that the U.S. Navy is mobilizing some of its larger ships, hospital ships, over the coastlines to be able to provide for more beds. There's military mobile hospitals as well that are currently being deployed. We know that China built and deployed 8 hospitals when this crisis started in December. So the U.S. is ready to do that, but we do have a problem, or there is a problem over there, and it is that there's a very important lack of protective equipment. So when you see doctors talk about PPE, personal protective equipment, this is something that is worrying a lot of them. These are pieces of equipment, garments, mouth guards, masks, not mouth guards, masks, sorry, gloves, face shields that are supposed to be disposable, so that as a healthcare provider, you put these on, you gown in, and you go see a patient who might be infected or who is confirmed with COVID. You do whatever you need to do, either take a sample or deliver care, and you dispose of them so that you don't get contaminated, your clothes don't get contaminated, and then the next patient doesn't get contaminated. What we're currently seeing is that a lot of doctors in the U.S., and this is not happening third world, this is happening in the U.S., are having to reutilize some of this protective equipment. They have to be wearing that same mask for their entire shift, 8-hour shifts or 6 hours or 10-hour shifts. We saw the same thing happen in Italy. We saw the same thing happening here in Spain. Another thing we're seeing is we are running out of ventilators and intensive care unit beds. Now, these are not just standard hospital beds. These are very critical pieces of our healthcare system where a patient who needs respiratory support can have it delivered. So those are the things that we're very concerned about. Measures are being taken, so don't panic. Certain measures are being taken, but we're still concerned, because if people don't do their part, if we don't do our part, no matter how many measures the government and the healthcare system as a whole take, this will overrun the capacity of the entire health system in the US, as it is overrunning it here in Spain, or as it overran it in Italy. And I don't even want to think about what's going to happen in Mexico and the rest of Latin America if these measures aren't being taken. Like I said, it is very worrying. Now, there's another thing that Dr. Beatty shared with me yesterday, and it is that a lot of people don't really stop and think about these healthcare providers who are now working across the front lines as people. And we tend to think of them, well, it's something that they're deciding to do, which they totally are. And I absolutely want to acknowledge all of my colleagues. As weird as it sounds, it pains me in a way to be stuck where I am right now in Spain and still not having gotten my papers to be able to practice here, because I'm not able to lend a hand except with doing these kind of videos. But truth of the matter is, we should not forget that they also have family members, they also have children, they also have spouses. So when they finish their shift, they have that fear of having contracted this virus and of bringing it home with them, bringing it home to their children, bringing it home to their spouses, bringing it home to their elderly relatives if they live with them. So those things are also something that we need to acknowledge and that we need to recognize. A lot of them, she confessed with me yesterday that a lot of healthcare providers are now bunking together and not going home because they're self-isolating because they don't want to risk passing it on to their families. And this is terrible because they're already overworked, they're already overburdened, burdened, they're already burnt out, and now they're even having or choosing to self-isolate in order to not put those loved ones at risk. So please do consider this. If you have a moment to spare and you can reach out to your doctor, to any doctor that you know is working out the front lines, any nurses, any nursing staff, any primary care providers, anyone in the system who you know is currently in the front lines of this situation. If you can reach out to them, whether a text message, social media mention, tag them on your different social media channels, or just give them a call if you're able to, and just say, listen, you know what? I want to acknowledge you for this. I want to recognize what you're doing. I want to thank you for it. And I want to let you know that I'm doing my part. I am doing what's within my capabilities, which is accepting this new normal and staying home and not putting more people at risk, not putting myself at risk, because I know that this is going to affect all of us. So keep them in mind when you think about not staying home, when you think about it's not such a big risk, when you think about all these things. If you look at the numbers of healthcare providers who are testing positive and who have to self-isolate and who are even developing complications is growing substantially. And I still think that we're not seeing the totality of these numbers. We're not seeing the full impact that this COVID is having yet on our society. So keep them in mind. If you have a moment, do reach out to them and let them know. I think that's it for today. For tomorrow, if you have any questions, please leave them below as usual. And I'll come back with some additional updates tomorrow and Friday and answering some of your questions. All right, so stay indoors, stay safe, and I look forward to seeing you tomorrow.